Acute and Chronic Pancreatitis and Exocrine Pancreas Insufficiency, EPI. So the functions of the pancreas are for digestion and defense. In acute pancreatitis, the pathogenesis can be, the first one is lysosomal dysfunction and the second is local inflammation. AHNP stands for acute hemorrhage necrotizing pancreatitis. Discuss the risk factors, the clinical findings, and the diagnosis, the hematology and the pancreatic enzymes, and the pancreatic specific test, which is PLI, which is pancreatic lipase immunoreactivity. The therapy for pancreatitis is fluid therapy, which is obligatory, analgesia, which is obligatory, and special diets. In chronic pancreatitis, it can be idiopathic or autoimmune. Discuss the symptoms and management. And in feline pancreatitis, in acute cases, it's caused by bacterial translocation. In chronic cases, it's caused by immune-mediated from IBD. And the treatment is mirtazapine, which is used to increase appetite, and steroid anti-inflammatories. And EPI, exocrine pancreatic insufficiency. It can be pancreatic acinar atrophy or chronic pancreatitis. The symptoms are pale, soft clay feces, and the diagnosis is decreased TLI. And the treatment is pancreatic enzyme substitution and special diet with B12 supplementation. So the functions of the exocrine pancreas are digestive enzymes and defense against autodigestion. So the digestive enzymes are alpha amylase, lipase, and trypsinogen. In the defense against autodigestion, the pancreas produces pancreas secretory trypsin inhibitor, also known as PSTI. It stops trypsin from digesting the pancreas. In pancreatitis, the defense against autodigestion mechanism is impaired, which leads to inflammation. In EPI, which is chronic, the production of digestive enzymes is impaired. So in acute pancreatitis, firstly is the lysosomal dysfunction. The lysosomes can't break down activated trypsin. This leads to local inflammation and acinar death. The increase of cytokines leads to systemic inflammation. With further trypsin production, trypsin breaks into circulation and causes generalized inflammation. A more severe form of acute pancreatitis is acute hemorrhage necrotizing pancreatitis, also known as AHNP. It can have local effects, such as on the pancreas itself, or regional effects, such as on adjacent organs. This can cause peritonitis. It can also have a systemic effect, so it can cause damage to distant organs. It can cause systemic inflammatory response syndrome, which leads to multiple organ dysfunction syndrome. To diagnose pancreatitis, we need to look at the signalment, the history, the clinical findings, diagnostic imaging such as ultrasound, routine laboratory tests, and pancreas-specific laboratory tests. It occurs mostly in miniature schnauzers, terriers, dachshunds, and poodles, in middle-aged to older-aged dogs, and in obese animals. So the risk factors are genetics in the case of miniature schnauzers, high-fat diets, hyperlipidemia in the case of obesity, and drugs such as potassium bromide and phenobarbital can cause pancreatitis. The clinical findings of pancreatitis are severe vomiting, anorexia, lethargy, and abdominal pain. There can also be dehydration and shock. You can see an increased heart rate and respiratory rate, and capillary refill time and dry mucous membranes. When doing diagnostic imaging, you do an abdominal ultrasound and you can see specific characteristic findings. It can be swollen. The pancreas itself can have decreased echogenicity due to necrosis, or the peripancreatic region can have increased echogenicity due to secondary local peritonitis. In the hematology, we can see increased white blood cells. We can also see hyperglycemia. Diabetes can be a consequence of pancreatitis. Other routine laboratory tests are looking at the pancreatic enzymes such as amylase and lipase. There are also pancreas-specific lab tests, such as looking at the PLI, the pancreatic lipase immunoreactivity. This is looking at lipase originating from the pancreas, therefore it's organ-specific. If the test is negative, it means there's no pancreatitis. For the therapy of pancreatitis, fluid therapy is obligatory, so is analgesia, it's also obligatory, and special nutrition is also important. So for fluid therapy, it's essential. If it's not performed, the pancreatitis will continue to worsen. The pancreas is particularly susceptible to hypovolemia, so give crystalloids and lactated ringers, and analgesia is also a must. It's a very painful disorder. You can give opioids. In a mild case, you can give butorphanol. When it's more severe, you give buprenorphine, and when it's the most severe, you give fentanyl. In the case of a special diet, the aim is to prevent malnutrition, feed the enterocytes, and to keep the pancreas at rest. You need to feed immediately and have a highly digestible and low-fat diet. In mild pancreatitis, have a very short fasting period, so 48 hours max. If the animal is not vomiting, give water, then carbohydrates, then an easily digestible protein, such as turkey. Give it in small amounts several times and have no fat. In severe pancreatitis, do not fast. Always feed immediately. Long fasting will cause atrophy of the gut mucosa because the enterocytes are not being fed. In chronic pancreatitis, it's more common in cats than in dogs. There's two types, idiopathic and autoimmune. The idiopathic type is found in toy breeds and terriers. The autoimmune type is more common in Cocker Spaniels, and it's more common in males than females. 50% can have diabetes and or EPI. The symptoms are it can happen for months or years. There's recurrent acute episodes, such as flare-ups. The management is a lifelong low-fat diet and give analgesics if they relapse. In feline pancreatitis, the etiology says there's two possibilities. There can be bacterial translocation and IBD, which is immune-mediated, which can cause chronic pancreatitis. Acute pancreatitis is more common in dogs. And in cats, chronic pancreatitis is more common. It makes up 92% of the concurrent disorders. For treating feline pancreatitis, in acute cases, it's the same as the dog, but you give more antibiotics. And in chronic cases, it's the same as the acute treatment, except you can give appetite stimulants such as mirtazapine and B12. You can also give anti-inflammatory doses. In exocrine pancreatic insufficiency, this is a progressive loss of the pancreatic acinar cells, over 90%, which leads to maldigestion and malabsorption. For the etiology, breed is important. In pancreatic acinar atrophy, PAA, German Shepherds make up 60% of the EPI patients. This is an autoimmune disease and it can affect young adults, but there's no diabetes. In chronic pancreatitis, cats and spaniels are more affected, and diabetes is possible in end stage, and older animals are predisposed. It's a chronic disease, and it results in weight loss and cachexia due to the malabsorption issue. And the diarrhea is very characteristic. It's pale, soft, and has clay-like feces. You can see undigested particles in the feces, such as a fatty stool. For the diagnosis, you do TLI, which stands for trypsin-like immunoreactivity. It's highly specific and sensitive for EPI. And the treatment for EPI is pancreatic enzyme substitution, this is a lifelong, and fix the diet. Give a highly digestible, moderate fat diet with no fiber, and supplement vitamin B12 and give antibiotics. For the surgery of the pancreas, it has two lobes and there's a high risk of iatrogenic pancreatitis. The surgeries you can do are a pancreas biopsy, pancreatic drainage in the case of an abscess or a cyst, and a pancreectomy. 90% of the pancreas can be removed without functional damage.